Bonjour, j'ai l'honneur d'ouvrir cette deuxième journée de notre comité régional et je passe tout de suite la parole à notre directeur exécutif, M. Rob Butler, pour des indications de teneur logistique.
Thank you very much, Nora. Good morning, everyone. Welcome, participants, both physical and online, to this, the second day of the 72nd session of the Regional Committee here in terrific Tel Aviv. Thank you, first and foremost, to our Israeli hosts and to the Minister for what was a very nice reception last night. I'm sure those of you that were there found it very enjoyable, so our sincere thanks to them. As many of you have seen, we sent out a mail last night with the revised program. If you haven't seen it, we'd be very happy to share it, both in hard copy. Anybody from the Secretariat can provide you with a copy, but it was sent by email last night to all participants. As you'll note, we've changed some parts of the program around. We've had to nudge things to Tuesday and nudge things further on then to Wednesday. So today we'll start with the RD replies after a short video that we'll be playing in a moment. We're then going to move on to achieving the highest attainable standards of health for persons with disabilities. We'll have a short break. We'll then continue that session, and then we'll move to the European Regional Action Framework for Behavioral and Cultural Insights for Health. There are 3 lunchtime sessions, as you're aware, also a ministerial lunch, after which we will continue with BCI, then be moving to the Regional Digital Health Action Plan, which of course will be continued as of yesterday. It was opened as the last item yesterday, as you'll likely recall. And then we move to strengthening health emergency preparedness, response and resilience, lessons learned and building back better. I think there are no important household updates for me to go into, apart from the one thing that I actually forgot to mention yesterday. Please take your headsets into lunch break and the parallel sessions. It's very important because we don't have sufficient numbers of headsets for everybody in both locations. So if you head to a lunchtime session, please take your headsets with you and then back into plenary. I think the event website is there for all information on those parallels. I'd also like to just thank the interpreters who've had a very busy day yesterday and will have 2 very busy days ahead. Thank them all for their effort. And then with that, I'd like to just introduce a video that we've received from the Prime Minister of Israel and a statement that the Prime Minister would like to make. So I'd ask for the video, please.
Shalom and welcome to Israel. This is the first time health ministers and professionals have met in person in this forum since the COVID-19 pandemic began. We are proud to be hosting this important meeting here in Israel. The world is a different place than it was 3 years ago. The pandemic reminded us how important global cooperation is. It reminded us that global challenges demand global solutions, that no matter how good we are individually, we are much stronger when we work together. This meeting will give you the chance to do just that, to share knowledge, experience, and to work together. It will also give you an opportunity to see Israel's system firsthand. Israel has a healthcare system we can be proud of. We have world-class medical services, hospital, clinics, research facilities. We integrate cutting-edge technology to improve healthcare for all. And we have some of the best medical teams in the world. They are at the heart of everything we do. They are the secret to our success. And we are grateful to them every day, grateful for the lives they've saved. I want to thank Health Minister Nitzan Horowitz for all the great work he has done this past year and for making this conference happen. On behalf of the government of Israel and the people of Israel, we look forward to working with you all to improve healthcare for everyone. Enjoy our beautiful country. We are delighted to have you here.
Merci beaucoup. J'en profite
Thank you
aussi
very
pour
much.
remercier
I'd like to take this opportunity to
Israël
also
pour son
thank
accueil. Je crois
Israel
que
for
nous sommes tous
their
impressionnés
welcome.
par
I think we've all been
la beauté
impressed
du lieu, mais aussi par
by
toute l'attention
the
qu'il nous a apportée.
this beautiful
Donc
place,
encore
but also
merci pour
by
tous ces
the
efforts.
hospitality that has been
Nous
shown us.
passons
So
donc,
thank you
comme
very much for
nous
that. And
l'avons décidé hier,
as we decided
à la
yesterday,
suite de la
we
discussion
will
sur
now
l'état de
continue
santé
with
dans la
the
région européenne
discussion
de
on the state of
l'OMS,
health in the
avec en
WHO
tout
European
premier lieu
region,
les commentaires et les réactions de
starting
notre
with
directeur
the
régional
comments
sur,
and responses
suite
from
au
the
débat
regional
qui a eu lieu
director
hier,
following
avec
the
énormément
debate
de
we
prises
had
de parole,
yesterday
énormément
with a huge
de
number of
propositions
statements and
et d'approches. Et j'ai
proposals.
donc l'honneur
So
de
I have the
passer
honor
d'entrée de
of
jeu la
now
parole à Hans.
giving the floor
S'il te plaît, je
to
t'en prie.
Hans. You have the floor.
Thank you very much, Nora. And first and foremost, I would like to express my very sincere appreciation to His Excellency, the Minister of Health, Nitzan Horowitz, for such a wonderful reception yesterday evening in a very, very beautiful environment, Todaraba. Esteemed ministers, esteemed colleagues, I will now give a reply on the several issues you raised yesterday, and I will club them according to the main theme of my presentation, which was the dual track. So first I will give a feedback on the dual track 1, the emergencies, and then go to the dual track 2, which are the essential health services, and the third part say something on the enablers. But first and foremost, I want to tell you that I'm very grateful for a very strong support for the proposed dual track approach and for your encouragement and strong endorsement for our work to deliver the EPW, its vision and agenda in what all of you were mentioning, a very challenging environment. Many of you emphasized that today's challenges are unprecedented and are not of a regional but of a global nature, necessitating global collaboration and responses. These include the three priorities of the pandemics, the war, and the climate change, highlighted by Germany and others like Malta and Spain. You also acknowledge the importance of collaboration and pan-European dialogue, as emphasized by France and many other countries. Shaping such collaboration, the dual track, clearly resonates with member state priorities and approaches. As Armenia, Tajikistan, Israel, and the UK, dual track approach to steer through choppy waters was quoted. You pointed to the importance to address the broader economic environment, including Malta, who emphasized the need to protect health budgets, and as Finland and Austria reminded the importance of health in an economy of well-being. Or as Lithuania said, we need to put health at the center of our actions. In your interventions, you emphasized the importance of addressing the health needs of vulnerable populations to leave no one behind. As Portugal said, we must strive for an equitable and inclusive tomorrow. I also want to thank the European Commission for its strong support to a multilateral system with a strong WHO at its core, and for the European Union's commitment to figure this prominently in the new European Union Global Health Strategy, as underlined by the Director General, Sandra Gallina, in her intervention. And thank you again, dear Sandra, for your presence here and your strong interventions. So let's go to the dual track 1, the emergencies. The Czech Republic, on behalf of the EU, underlined the international health regulation strengthening as a legally binding instrument to be at the core of a new global health architecture with WHO at the center. I heard many of you highlighting the progress made in the INB negotiations and the consensus about the legally binding nature of the future international instrument to be further negotiated. I also heard the strong plea to protect and preserve multilateralism, highlighted in a number of statements, like from Denmark and Austria. Many of you underlined that the COVID-19 pandemic has painfully revealed health system gaps, in particularly the health workforce challenges, with inadequate profiles and shortages, by Tajikistan, Belgium, Denmark, Malta, Greece, and Lithuania. Thank you for the clear message from many of you that we need to build resilience in the region and of our communities. particularly that was from Belgium. There is a broad consensus from your statements that we need a strong WHO with adequate capacities to support member states to manage health crisis effectively. Many of you refer to the all hazards approach required. As Slovakia and others emphasized, in this context, multilateralism is critical. Or as Spain said, we need to get our act together. Thank you for the strong support for the Global Health for Peace initiative and for acknowledging health as a stabilizer to build trust and address inequalities. From Switzerland and Austria. And we are very grateful for the strong support from Switzerland to move this agenda forward, and you personally, Nora, and for the region to play a key role in developing the global roadmap. Actually, I was particularly impressed about the strong engagement at our parallel session yesterday we had of youth delegates. It is important that we use every opportunity to use health as a stabilizing factor, to use health as a bridge for peace, and to address health inequities in societies to prevent future conflicts. By this, we can build trust and social cohesion by streamlining conflict sensitivity in our response operations. United Action for Better Health is the core of the European Programme of Work. And I'm very glad to see such a strong cooperation and solidarity in support what we are providing to Ukraine together with the European Union, the European Commission, many countries from you present, to address the health implications of the humanitarian crisis and help the country maintain, rebuild and build back smarter its health system. And I would like to thank the Ukraine delegation for confirming yesterday to be ready with the Minister of Health, Dr. Viktor Lashko, to go on my 4th mission this year to Ukraine, the week of 10 October. Thank you very much, and I'm very much looking forward. Now I will reply according to dual track 2, maintaining essential services. Retaining health at the center of the agenda and building resilient health systems in a changing world is work for us all. Lithuania and Belgium. Listening to you, it is clear that health system resilience is a priority to deal with emergent and potential future threats and to continue both providing essential health services and continuing our fight to improve public health and tackle both communicable and non-communicable diseases. As Belgium, Malta, Cyprus, Greece and others have said, resilient health systems are a priority, and particularly here, the health workforce. I would like to thank again the Minister of Health of Romania, Professor Alexandru Rafila, for organizing next year the high-level regional conference to chart the way forward on the health workforce. And remember that tomorrow we will launch, during the lunch, the first ever pan-European report on the status of the health workforce in the region, with data from 53 countries and 10 very concrete actions. We need to protect the health budgets, you told, to address the shortage in the health workforce and their impact on health service provision. We need to ensure that digital health for the people is at the center of the health systems and ensure an economy of well-being for health. And thank you very much to Finland for having consistently supported the movement of the economy of well-being for health. And we are very much looking forward to a major conference very soon. At the same time, our fight against NCDs and the risk factors is a priority for all of us, I heard. And I am heartened to hear the progress in our joint endeavors. I would like to thank Turkmenistan, Spasiba van Bolshoye, who this morning was making a proposal for a celebration of the 10th year of the Ashgabat Declaration on NCDs, and we're going to follow up with Turkmenistan. I am very grateful to see strong support of many countries to the NCD agenda, including the commitments expressed by the Russian delegations to further invest in this important area. Several of you acknowledged progress made through and in collaboration with key programs and GDOs in areas such as quality of care, Greece, improving access to medicines and their affordability, Norway and Georgia, access to quality of services, Greece and Montenegro, the crucial role of primary health care, Kazakhstan, as the organization and delivery framework and putting patients at the center of the systems. Thank you again to Kazakhstan and Dr. Azar Geniat for having announced both to host Regional Committee next year in Nur-Sultan, but also to have a global meeting to celebrate the 45th anniversary of the Alma-Ata Declaration and the 5th anniversary of the Astana Declaration. We're very much looking forward to come to beautiful Kazakhstan and commemorate this together. Yesterday, during the ministerial lunch, we received strong support for the WHO Europe statement committing to identify solutions to improve access to effective, novel and high-priced medicines in the region through the establishment of the multi-stakeholder platform. I thank everyone for this mandate and this trust that you see that the WHO Regional Office for Europe plays this role of neutral broker between public and private sector to move towards sustainable, equitable access for high-priced, innovative medicine. And particularly thank you to the Minister of Health and Care Services of Norway, Minister Kjerkol, for the Oslo Medicines Initiative. This statement is the result of 2 years of determined, inclusive and participatory work, because we engaged in meaningful consultations with all stakeholders and partners, including the patients, the civil society, the insurance companies, the European Commission, the OECD, the private sector, and independent experts. Actually, yesterday noon was the first time that we invited high-level representatives of the industry, and it was heartening to hear the trusted role that WHO has and how we can leverage our work to complement and support the European Union pharmaceutical strategy. And thank you also to the Director General of FPA, Nathalie Moll, for her efforts. We must also continue our efforts to strengthen routine immunization, you told us, in the countries, while maintaining our efforts to contain COVID-19. At the same time, I heard your concern on the re-emergence of polio in our region and interruption to routine vaccination programs for polio. And thank you again to Iceland and to the President Guðni Johannesson for inviting me Friday to Reykjavik. I'm very much looking forward, together with the first ever female President of Rotary International, on a global action summit, and we're going to ask the Rotary to continue to strongly support WHO in the eradication of polio. Given the changing and uncertain socio-economic and political climate, we see a major impact on mental health for all ages and across the whole region, every country. And this should not be understated. And we heard this from many, many countries. Actually, yesterday late night, or I should say early this morning, when I was finishing my work, I got a WhatsApp. I say, who is working like me so early in the morning? And I looked and it was subscribed by Isaac Herzog, the President of Israel, who was telling Dr. Kluge, I take your word that the First Lady of Israel will be in contact with you on the mental health initiatives. And I really have to say Toda Rabba to Israel for the support, and particularly the First Lady mentioned the support to Ukraine on the mental health issues. Thank you so much, Israel, for this. The next one is that we heard the importance of science and ensuring a robust evidence base for our work. And as you heard, this was clear in the 3 priorities I put forward. I want again to thank here Professor Martin McKee of the London School of Hygiene and Tropical Medicine, who is going to take the lead of a major report that we're commissioning after the RC to identify gaps and advise how to increase scientific excellence and rigor, horizon scanning, new partnerships, capacity strengthening science communication, and the thorny issue of ethical approval. And remember, dear ministers, I always say it's particularly in times of scientific uncertainty that WHO can be at its best to stand next to you in shaky times. We have been taking the lead, as you know, globally in scientific uncertain times, for example, on the booster, notwithstanding global solidarity, long COVID, and many other issues, and we will continue to do so. Your clear support for behavior and culture insights and our work in this area together was also very, very loudly heard. As well, that it heartened me to hear of the importance you attach to One Health vision. Here, I would like to express my great appreciation to Hungary, who commits to have mid-next year the next 5-year ministerial conference on health and environment. And the president herself of Hungary agreed to be the patron of this conference. Goal number 2 of EPW, to have health at the top of the political agenda. I'm very much looking forward, Excellency, to meet you during afternoon coffee break. Health for all and leaving no one behind are not an empty slogan for me, but what is really central for health, social cohesion, and ultimately wealth. I want to thank also my brother, Josep Figueras, from the European Observatory. We're working very closely together. We launched yesterday a new publication series called Health Systems in Action. Each of them providing 30-minute read of how a country's health system is made up and what strategic challenges it faces. This new series is very close to my heart. It complements the well-established country health profiles for the European Union countries by specifically targeting non-EU countries, which you know is a priority for me. This was really a momentous job, and again, I also want to thank Susie Lesov, and the whole fantastic team. I will finish with the enablers, what I heard. Many of you acknowledged that the big issues we face are interlinked across the globe and needs inter-region collaboration. You heard the inspiring speech of the region director of PAHO, Dr. Carissa Etienne, yesterday. I'm also very grateful to the United States of America, Department of Health and Human Services, who recognizes the need for this transatlantic cooperation and for having committed to a cross-Atlantic partnership, including on the Arctic Council. At the same time, you reminded me that global collaboration needs to trickle down to sub-regional collaboration. Thank you for your support of the Western Balkan Roadmap, supported by the Southeastern European Health Network, and by the EU, as you heard from the Commissioner Oliver Varhelyi yesterday, and also the Central Asian Roadmap. But to support such collaboration, you emphasize the need for a strong and well-financed WHO. Slovenia said WHO as the garden of science, and Belgium said, in these troubled times, we need WHO more than ever before. And Greece told, we support WHO, and WHO supports us back. And again, danke schön to Bjorn Kummel for your leadership in this working group to get to the World Health Assembly historical resolution on sustainable financing for WHO. It's really a tour de force. Thank you for acknowledging Euro's effort to become more fit for purpose. This is a priority for me. And you know, I have started a major reorganization when I became region director in order to pull off the EPW and live within my means, including a creation of an enabling hub, functional hub, enabling hub in Istanbul in Turkey. I know that this creates some level of anxiety among the staff, but I always did it in transparency with Nora, with the SCRC, with the staff association, and I would like to further commit that we'll do the reorganization in a psychological safe work environment with the staff and with zero harassment policy. Thank you for highlighting the country collaboration strategy as well. I hope for your support tomorrow. And you equally applauded WHO's efforts to strengthen country leadership, including through the European Leadership Academy, hand in hand with the Global Academy, which I visited with Professor Jérôme Salomon in Lyon. And we continue that way, Professor Salomon. Actually, the first cohort of 8 young public health leaders of the Western Balkan and the eastern part of the region is graduating in October despite of the COVID-19. I'm very proud of this. And we're starting in 1 month the second tier, mid-level directors of your ministries from 10 countries who will come for 4 months to WHO Regional Office for Europe and then go back. Finally, I'm coming to the host country, Israel. Thank you for offering to host a Center of Excellence on Digital Health according to the prescribed governance mechanisms and consultation through SCRC. The same for Romania on behavioral insights and Cyprus for establishing a country office.